How are you feeling?
I'm feeling fine.
Tom Tischer is one of 250 patients from Olympia's Providence St. Peter Hospital to get in-home treatment thanks to a COVID waiver.
So we're just going to do the sliding scale for now.
Since 2020, hospitals have been allowed to treat low-risk patients in their own homes as long as nurses come by at least twice a day and doctors check in virtually daily.
They had tools where a doctor at a distance could listen through a Bluetooth-connected stethoscope.
Ben Shamshore got at-home treatment just last month.
Amazing.
He and his wife, Marge, high school sweethearts, have been regulars at the hospital over the past decade due to Bob's autoimmune issues. They both loved getting his IV antibiotics at home for a change.
I knew exactly when the doctor was going to be visually available, and it was really nice because otherwise, when he's in the hospital, I have no idea, and I never got to see the doctor.
We take care of people with pneumonia at home, but only on a little bit of oxygen. So if you need high flow oxygen or if you're on a ventilator, you're too sick to be at home.
Dr. Chris Dale heads up the at-home practice at St. Peter. He testified with other doctors and hospital administrators in favor of a bill to allow it to continue past this May. He says it opens up beds for the sickest patients, and in most cases, folks recover better at home.
Being in the hospital is very stressful, not only on patients, but on their families. And in hospital at home, the families get to be there.
I was happy to be the one opening up a room.
The Shamshores would rather worry about their jams than their health, but with Ben's condition,
He'll use it again. He'll get another infection, guaranteed. So it's nice to know once he gets stable that he can come back home and finish the IVs.
but that can only happen with legislative approval. During testimony on the bill, the state's Department of Health raised some concerns, asking about the standards being used for determining which patients qualify and how often they're meeting with doctors and nurses. Both the House and Senate versions of the bills come up for committee votes tomorrow. In Olympia, Drew Mickelson, King 5 News.